Assalamu alaikum. Beta, in this video lecture, I will deliver another chapter of your ENT series of lectures, that is chronic inflammatory diseases of the nose and the paranasal sinuses. Actually, this chapter is little. Let me explain you what I'm trying to say. In the previous video lecture, I delivered you about the acute rhinosinusitis, right? Acute rhinosinusitis, right? Initially we discussed the viral rhinosinusitis, then we actually specified and we discussed the viral rhinosinusitis by influenza, right? And then I shifted to the acute bacterial rhinosinusitis, right, which were more focused on the problems in the sinuses. Like I told you about the frontal sinusitis, right? Similarly, maxillary sinusitis, right? And likewise ethmoid and sphenoid sinusitis, right? This is what we discussed in the previous chapter. And now here in this video I'll be telling you about the chronic rhinosinusitis, right? It will take few minutes to deliver the chronic rhinosinusitis. Then I will shift towards the surgical management of all these. Surgical management of the frontal sinusitis, maxillary, ethmoid and sphenoid sinusitis, as well as the surgical management of hypertrophied inferior turbinates. Hypertrophied inferior turbinates are seen in case of especially like DNS, seen in case of rhinosinusitis. So I actually want to tell you that I'll be starting from this chronic rhinosinusitis. Then at number 2, I'll be delivering the surgical management of the frontal sinusitis, maxillary, ethmoid and sphenoid sinusitis, and the surgical management of the hypertrophied inferior turbinates. And at number 3, I will shift toward and will discuss the fungal rhinosinusitis and then atrophic rhinitis, right? And this is all about this chapter. So let's start with the chronic rhinosinusitis. But in case of chronic rhinosinusitis, everything is going to be similar like acute rhinosinusitis. The difference is of the duration. It stays for longer, 3 months or more, right? And if you talk about the clinical presentation, it is almost very much similar. Like if you look at the mucosa of the nose, look at the mucosa of the sinuses, it is very much congested, very much edematous, just like the acute. But the difference is, in case of chronic rhinosinusitis, you may come across and see there may be polyposis in the mucosa due to long standing chronic inflammation. What is polyposis? Here if I tell you, if this is the this is your nose, this is a palate and below is the mouth, and if you see this is the congested mucosa, very much thick edematous mucosa, right? This congested mucosa, edematous mucosa, is seen in acute rhinosinusitis, seen in chronic rhinosinusitis. But one thing that you will see in chronic rhinosinusitis, if it stays for long time, that is the polyposis. Itni mucosal outgrowths, polyposis from the mucosa, right? The polyps coming out, polyposis, right? So इसी बेस पे हम chronic inflammation को, chronic rhinosinusitis को दो हिस्सों में डिवाइड कर देंगे. Chronic rhinosinusitis with polyposis, right? And chronic rhinosinusitis without polyposis, isn't it? Yeah, that's it. So now let me take you to the book. Now let me take you to the book and let's see what's happening here. Chronic rhinosinusitis, it's the inflammation of the nose and the paranasal sinuses lasting for more than 12 weeks duration, that is 3 months duration, और बीच बीच में acute exacerbation होती है. ठीक है, यानी कि एक्यूट अटैक्स आते हैं पेशेंट को। द पैथोलॉजी, द क्रॉनिक राइनोसाइनसाइटिस में फॉलो द सिंगल और रिपीटेड अटैक्स ऑफ एक्यूट राइनोसाइनसाइटिस। इसका मतलब बहुत ऑब्वियस है कि अगर आपको एक अटैक हुआ एक्यूट राइनोसाइनसाइटिस का, या फिर रिपीटेड अटैक्स हो रहे हैं एक्यूट राइनोसाइनसाइटिस के, और उसके बाद अल्टीमेटली क्या हुआ आगे चल के, क्रॉनिक राइनोसाइनसाइटिस डेवलप हो गई। सही है। सो क्रॉनिक राइनोसाइनसाइटिस में फॉलो सिंगल और रिपीटेड अटैक्स ऑफ एक्यूट राइनोसाइनसाइटिस। ठीक है। Okay, the same thing, edema of the sinus mucosa. Edema depends. It may be the slight thickening to gross polyposis. इतनी एडिमेटस हो कि बाहर पॉलीपोसिस की फॉर्म में, जैसे मैंने आपको बना के दिखाया वैसे हो सकता है। ठीक है। और ये पॉलीपोसिस आपको मिलनी होगी तो क्रॉनिक राइनोसाइनसाइटिस में ही मिलेगी, लेकिन एक्यूट में नहीं मिलेगी। एक्यूट के अंदर सिर्फ म्यूकोजा जो है वो एडिमेटस होती है। एंड ऑन द बेसिस ऑफ प्रेजेंस एंड एब्सेंस ऑफ द पॉलीपोसिस, chronic rhinosinusitis is classified as I told you, chronic rhinosinusitis without polyposis and with polyposis, right? It's easy. And some changes that you will see in the surface epithelium of the nose and the paranasal sinuses is the epithelium desquamate. It obviously, once it desquamate, it will try to regenerate again. Simple. You will see very rarely ulceration and metaplasia in the skin as well. The organisms responsible for chronic rhinosinusitis are usually mixed, जिसमें बहुत सारे आ जाते हैं, जैसे कि streptococci, pneumococci and proteus, anaerobes. So they together, not alone, they together produce the chronic rhinosinusitis. I hope it is easy, not really difficult. If I am suffering from chronic sinusitis, how I'll be presenting? मेरी हिस्ट्री बहुत पीछे की होगी बेटा। I'll be saying like I have this problem for previous 4 months. I'll never say I am suffering from this condition for a week or 3 days or 4 days. I'll have a long big history, right? Picture same ही होगी, acute जैसी होगी, जैसे कि look, the picture is similar to acute rhinosinusitis but of lesser degree. Chronic के अंदर symptoms suppress हो जाते हैं। ठीक है। The problem in chronic is it stays for longer, right? But the symptoms are of lesser degree. The symptoms like nasal discharge as in acute case and the post-nasal dripping. Okay. The nasal obstruction. Obviously, if this is the nasal mucosa, again you see it, this is the nose. This is the nose and this is the palate. This is the posterior opening, the posterior nair. If the obstruction is here due to the polyposis, it may be due to the polyposis, it may be due to the edema. But the obstruction is there. So if there is the obstruction, so due to obstruction, I mean to say that the secretions will not be able to drain here, they will keep on running here. So there will be nasal discharge. And before this obstruction develops, there is lots of secretion here, which becomes noticeable draining from this side as a post-nasal dripping. Also, because of the nasal obstruction, some headache is present. Headache is present when there is obstruction to the drainage or during the acute attacks right? What sort of headache it is? Headache is not like a typical headache. It is more like a feeling of heaviness in the head or dull ache over the sinuses. ठीक है, कितनी बातें की? Increased secretions in the nasal cavity. तो डिस्चार्ज बढ़ जाएगा, पोस्ट नेजल ड्रिपिंग भी होगी, ऑब्स्ट्रक्शन मिलेगी। ठीक है। ऑब्स्ट्रक्शन के अलावा हेडेक मिलेगा। हेडेक किस क्वालिटी का होता है? डल, लाइक हैवी फीलिंग इन द हेड और डल एक ओवर द साइनसेस। और जाहिर सी बात है ऑब्स्ट्रक्शन की वजह से जो ओडोर मॉलिक्यूल्स हैं वो पूरे आपके ऑल्फैक्टरी रिसेप्टर्स तक पहुंच नहीं पाएंगे, तो यू विल be having a reduced sense of smell, that is hyposmia, or complete loss of smell, that is anosmia, or you may come across a problem that is the cachosmia. It's not really good condition, it's a perversion. Like cachosmia is something in which patient perceive the unpleasant or foul odor that aren't really there. किसी वक्त भी आप पेशेंट को कहेंगे स्मेल करें, वो बोलेगा बहुत बदबूदार स्मेल आ रही है मुझे, हालांकि वो वहाँ नहीं होती। So that's said to be the cachosmia, right? Some constitutional symptoms in chronic rhinosinusitis include malaise, generalized feeling of malaise, mental apathy, एनोरेक्सिया जिसके साथ नाउजिया वॉमिटिंग होती है, सही है, इस तरीके से. सो यू सॉ pathology is almost same as of acute rhinosinusitis, but the difference is of polyposis. Clinical presentation is almost similar, but what is the difference then? This problem is for longer period of time in chronic case, and in acute case this will be for shorter duration. The problem is of lesser degree, and in case of acute it will be of some severe degree, right? Okay, let's go a little ahead. Yeah, some investigations to be ordered. Some investigations we can order in case of chronic rhinosinusitis. We can do the nasal endoscopy. It gives you the detailed examination of the nasal cavity, especially middle meatus में जो problem चल रही है, ये हम under local anesthesia करते हैं. और nasal endoscopy is really acceptable these days because it gives the detailed view, detailed examination of your nose. Right, beta? Okay. Then another thing is the plain X-ray of the paranasal sinuses, lateral view या waters view में. तो क्या फाइंडिंग्स मिलेंगी? जाहिर सी बात है, साइनसाइटिस होगी तो आपको म्यूकोजल थिकनिंग मिलेगी, एडिमा की वजह से पॉलीपोसिस मिल भी सकती है, नहीं भी मिल सकती, डिपेंड करता है. और क्योंकि साइनसेस के अंदर इतनी सारी सिक्रेशंस कलेक्टेड हैं तो यू विल हैव ओपेसिटी इन द साइनसेस. ठीक है. यू कैन ऑर्डर CT स्कैन. इट इज़ नाउ कंसिडर्ड एज अ मैंडेटरी इन्वेस्टिगेशन chronic rhinosinusitis के पेशेंट्स में. The CT scan clearly shows condition of all the paranasal sinuses and nasal cavity. Paranasal sinuses के अंदर जो वॉल की थिकनेस है एडिमा की वजह से वो भी दिख जाएगी. साइनसेस के अंदर जो फ्लूइड है, सीक्रेशन जमा हो गई है, वो भी दिख जाएगा. ये भी दिख जाएगा कि ऑस्टियम ब्लॉक है या ओपन है. इसी तरीके से इसी तरीके से बेटा जो नेज़ल कैविटी की कंडीशन है वो भी अच्छे से दिख जाएगी कि ऑब्स्ट्रक्शन तो नहीं है, म्यूकोजल एडिमा कितनी है, पॉलीपोसिस है नहीं है, ये सारी चीज़ें दिख जाएंगी. और जो नेज़ल सिक्रेशंस आ रही हैं बेटा, जो नेज़ल डिस्चार्ज आ रहा है उसको कल्चर सेंसिटिविटी के लिए भेज देंगे ताकि माइक्रो ऑर्गेनिज्म का पता चले. ठीक है. जब हम एंडोस्कोपी कर रहे होते हैं उसी वक्त हम सैंपल ले लेते हैं सिक्रेशंस का ताकि उसको हम कल्चर सेंसिटिविटी के लिए भेज दें. द पॉसिबल ट्रीटमेंट ऑप्शन फॉर द क्रोनिक राइनोसाइनसाइटिस इज गोइंग टू बी more like the treatment of acute rhinosinusitis. I mean, if you have this condition, it is bacterial. You provide the patient with the appropriate antibiotics to relieve the bacterial infection. And to relieve the obstruction, you provide nasal decongestants. To relieve the irritation, which is usually seen, you provide the patient with antihistamine. And to, kind of अगर बहुत ज़्यादा म्यूकस कलेक्ट हो जाता है नोज़ के अंदर पेरानेज़ल साइनसेस में तो उसको एक्चुअली ब्रेक करने के लिए यू प्रोवाइड द म्यूकोलिटिक एजेंट्स एंड आल्सो स्टीम इनहेलेशन टू प्रोवाइड द सूथिंग इफेक्ट, comforting effect, right? And after all this comes the surgery if the medical treatment gets failed. And now I'll be talking about, as I mentioned, that here we are done with this part. I'll be telling you the surgical management of the frontal sinusitis, maxillary sinusitis, ethmoid and sphenoid sinusitis. Then the surgical treatment to get rid of that, this hypertrophied turbinate, right? Inferior turbinate. So let's start with all these.